Big changes are coming for some Texans who currently work from home.
Do you imagine that if those employees were not working from home but were in the office, that y'all could operate more efficiently?
State lawmakers and the governor asking questions about remote work, why the pressure could push many state workers back to the office. A Texas House committee has the goal of delivery of governmental efficiency. We look closer at what the power the Texas DOGE committee actually has and how it's different from DOGE in D.C. Tears and tributes at the state capitol.
He was my advisor. He was my mentor. He was my personal hero.
Lawmakers honor one of their own after a congressman's death leaves a vacancy in Washington.
Produced from the Capitol in Austin and airing statewide, this is the award-winning State of Texas.
Hello, and thank you for joining us. I'm Dylan McKim. Last week, workers for several state agencies received emails about changes to work-from-home policies. The office of Governor Greg Abbott confirmed that state agencies will review policies and bring workers back to the office, quote, where possible. Multiple state employees have reached out to us asking if they have to go back to work in the office for their respective agency. None of them wanted to speak to us on camera in fear of retaliation, so we went looking for answers for them. There are more than 100 state agencies. We reached out to 32 of the biggest ones. Hi, good afternoon. Searching for what's next after a spokesperson for the governor's office said, quote, with remote federal workers returning to the office where possible, it's important that state agencies ensure they do the same. An employee with the Texas Workforce Commission confirmed the agency wants everyone back in the office full-time by the end of March. And Thursday afternoon, we confirmed multiple agencies like the DMV, State Health Services, and Health and Human Services sent emails to staff about plans to bring everyone back in the office. But other agencies say they are still reviewing policies. For some agencies, like the teacher retirement system, it won't be easy to make everyone come back to the office.
Representative Alders.
In the first ever DOGE hearing, lawmakers asked the agency's executive director about its remote work policies. The 1,200 employee agency says more than half of them are working 1 to 2 days from home.
Do you imagine that if those employees were not working from home but were in the office, that y'all could operate more efficiently?
We have not seen a dip in operating efficiency with having those employees have a day or two being able to work from home.
The director did say he would bring employees back to the office if told to do so, with the exception of the about 300 telephone counselors who work outside of Austin.
I would much like to prefer to have my telephone counselors stay at home.
A survey of multiple agencies in November show remote work helps many agencies with retention and recruitment. A new bill referred to the DOGE committee would give agencies the discretion to allow certain employees to work from home. This comes as a bill filed in the state legislature takes aim at where state government agencies are located. The bill, drafted by Senators Mays Middleton and Charles Perry, proposes physically moving the headquarters for certain agencies out of Austin.
You know, for a long time, I've had this idea of, well, why not, move them to lower cost real estate around the state?
Middleton says his plan could save taxpayers millions and create job opportunities in different parts of the state. Others are skeptical and point to the difficulty and cost of relocating agencies and their workers. That was one topic at the first meeting of the new Delivery of Governmental Efficiency Committee in the Texas House. The DOGE committee is supposed to curb fraud, waste, and corruption at the state level, but what power does it actually have? Capitol reporter Adam Schwager found committee members are still working to answer that question.
Perhaps you've heard of it.
DOGE.
The federal government's Department of Governmental Efficiency has garnered praise and protests. Now, it's being brought to the Texas House in the form of the Delivery of Governmental Efficiency Committee. 8 Republicans and 5 Democrats tasked to
reset the state government, put it on a diet, if you will.
Between layoffs and resignations, Elon Musk's DOGE has likely reduced the federal workforce by over 100,000 people, something state workers in Texas are keeping a close eye on.
Anyone who cares about their local library, anyone who cares about their public schools, anyone who cares about public universities, this is something we need to care about.
Those public employees have reason to be suspicious.
it can't be seen separate from the larger push to, again, downsize the size of the state government, similar to what DOGE is doing at the federal level.
One key difference between the DOGEs: at the federal level, DOGE acts like an agency, avoiding the legislative process. In Texas, DOGE consists solely of legislators, with state representatives from both parties contributing.
At the national and federal level, it certainly does look like layoffs and cuts, and I am hoping that it won't go in that direction.
After their first meeting where they laid out the stated mission of eliminating waste, fraud, and corruption, it still remains unclear the exact approach they take, as
we'll be looking at using scalpels in our, and we'll also be able to look at sledgehammers. We're going to look at everything, and we're going to do this with bills, we're going to do it with legislation, and we're going to do it with investigations.
For State of Texas, I'm Adam Schwager.
The Texas House has already referred nearly 30 pieces of legislation to the DOGE committee, including a bill to add restrictions to state employees working from home. And flags at the Capitol flew at half staff for a few days last week in honor of a Texas congressman. Sylvester Turner died Wednesday in Washington. He was 70 years old. Turner dedicated his life to public service. He was elected to Congress last year after 2 terms as the mayor of Houston. Before that, he served for decades as a state representative. On Wednesday, former colleagues at the Texas Capitol paid tribute.
His legacy is one of tireless advocacy. He represents a fierce commitment of justice and relentless drive to improve the lives of those in need.
Sylvester was more than just a colleague for me. He was my advisor. He was my mentor. He was my personal hero.
On Thursday, the Texas House approved a resolution to allow Turner's casket to lie in honor at the Texas Capitol. That will happen next Thursday and Friday. Turner was just 2 months into his term in Congress. It's up to Governor Abbott to call a special election to replace him. Until then, the Houston area congressional seat will remain empty. A vote at the Capitol aims to boost efforts to find a cure for dementia. The new approach from Texas lawmakers that could ask voters to make a multi-billion-dollar decision.
We can make sure it's safer for not only the people that are going to the hospital, like our patients, but also all employees. I think it's a good thing to be doing.
Widespread support so far at the state capitol for legislation that would require security barriers to prevent crashes at hospital entrances across Texas. But see why not everyone thinks the measure is a good idea. The Texas Senate passed legislation Wednesday that would invest more than $3 billion to find a cure for dementia. Senate Bill 5 would create the Dementia Prevention and Research Institute of Texas. Senator Joan Huffman carried the bill.
This will touch the lives of almost every Texan. And so I can't think as a body, as a legislature, that we could make a wiser, more prudent, better investment for the people of Texas and for future generations of Texas than to make this investment.
Huffman points out that the older population in the United States is expected to double by 2030. Health experts say as that population grows, so does the number of people with dementia. And the search for a cure is a priority for families facing the disease.
That sweet face you see is her.
Romy Lessig remembers her mom, Vicki, as a rock everyone could rely on.
She was the mom that everybody could call and talk to about things if they didn't want to talk to their own mom, but they wanted to talk to somebody.
And a lover of flamingos.
So if you want to make her happy, wear flamingos.
Keeping her mom happy is a priority nowadays. She's diagnosed with dementia, and Lessig is slowly losing her. She said her mom, a former librarian, had to stop one of her favorite things.
So?
Reading.
She goes, I flipped the page and I don't remember anything that was on that page anymore.
It's the cruelest disease.
Secretary of State Jane Nelson knows that pain. She watched dementia take her mom from her. She also knows what it takes to start an initiative like the proposed Dementia Prevention and Research Institute of Texas. It's modeled after the state's Cancer Prevention and Research Institute, which she helped create.
And even though we had universal agreement that we needed to step up the fight against cancer, it was one of the toughest bills that I ever carried.
It faced skeptics, but 18 years later, Nelson said it's made Texas a leader in cancer research, and she hopes the same happens for dementia research. The National Institutes of Health said in a report, dementia research has advanced at a remarkable pace in the past few years, helping scientists get closer to developing effective prevention.
I'm not naive enough to think we can do anything that will help my mom.
Lessig knows it may be too late for her mom, but she still has her children in mind, hoping for a better future with more happiness.
I want something more for them. I want them to have more happiness, more health. And it's going to take time, and we got to start now.
The bill now heads to the House. If passed, the Institute would still need approval from Texas voters in a constitutional amendment election. And we mentioned that the legislative initiative would follow the model of the Cancer Prevention Research Institute of Texas, or CPRIT. In 2007, Texas voters approved $3 billion to create the institute. Texas voters put even more money toward that effort in 2019. In all, investing $6 billion toward cancer research and prevention. New state guidelines for injections like Botox after our investigation, plus new legislation for more oversight of the industry following our reporting.
Bipartisan support for a bill state lawmakers say will make patients and hospital staff safer. It follows our investigation and hundreds of crashes into medical centers across the country. I'm investigator Matt Grant. I'll have that update from the Capitol coming up. More than a year after a drunk driver slammed into an Austin ER, killing herself and seriously injuring 5, including all 4 members of the Bernard family.
Why did it happen to us? Why did we survive this?
There's growing bipartisan support for a proposal here at the Texas Capitol, sparked by our investigations aimed at preventing other disasters across the state.
It's a common sense bill.
Democratic State Senator Royce West says his bill will save lives. How much of an influence did our reporting and the Bernard family story influence your decision to file that bill?
Very much. It really did. You end up being, I guess you could say, vessels of information for us to look at legislation.
Senate Bill 660 expands what the Austin City Council approved in December, requiring the installation of crash-tested security barriers called bollards at hospital entrances statewide.
I would be very surprised if it didn't pass.
Will this bill get a hearing?
Yeah, definitely will get a hearing.
West's bill was referred to the Senate Health and Human Services Committee.
That's another common sense approach.
Chaired by Republican Senator Lois Kolkhorst, who wants to work with hospital groups on new safety standards.
We talk a lot about patient safety. You certainly don't want to have to think about walking out of an ER or being close to an ER and having someone crash through it.
We found more than 400 instances in the last decade of vehicles crashing into or at medical facilities across the country.
We also took our findings to Republican Senator Bob Hall, who sits on the committee and has worked on patient safety legislation in the past.
It would be different if there were just an isolated incident someplace that this happened. But as you pointed out, there are enough of them now to say this is a major problem.
I am literally in shock.
Dr. Ray Callis is president of the Texas Medical Association, which advocates for 60,000 Texas physicians and medical students. He didn't know the problem was so broad until we told him.
If we can even save one life and we can make sure it's safer for not only the people that are going to the hospital, like our patients, but also all employees, I think it's a good thing to be doing.
While TMA doesn't have a bollard policy or an official position on West's bill, Callis says it needs to be considered.
I would definitely be in support of anything that will improve patient safety and physician safety and hospital safety for all Texans.
Similarly, the Texas Nurses Association tells us elected officials should explore all options that may create a safe environment for all healthcare workers and those receiving care. But not everyone is on board. In a blog post at the start of the legislative session, the head of the Texas Hospital Association, which advocates for more than 85% of the state's acute care hospitals, called the bill misguided, writing, "A mandate for bollards is an unreasonable administrative cost burden that could impact access to care and the cost of care for many Texans. It's crucial that hospitals be allowed to independently assess safety measures on the needs of their communities."
Whenever I travel over the state, I see some with bollards, some without.
But absent any local, state, or federal requirements, our investigation found a patchwork system where some hospitals do not have bollards, or like St. David's North Austin Medical Center, only installing them after a tragedy like last year's.
If they aren't going to do it, then we in the legislature have a responsibility to protect the people of Texas.
St. David's is currently facing $1 million lawsuit for not having bollards. The hospital system says it doesn't comment on litigation or pending legislation, but previously told us it will work with policymakers to ensure compliance with any new legal or regulatory requirement that may be passed. At the Capitol, Matt Grant, State of Texas.
Well, thank you, Matt. You can catch up on our year-long investigation now before this bill progresses through the session. Just look for the Preventing Disaster links on our website in this week's State of Texas story.
Why does Texas need this legislation?
We need to make sure that injury and harm does not occur.
More oversight could be coming from the Capitol surrounding Botox injections in Texas. The bill and new statewide guidelines now in place. A major step toward patient safety and consumer transparency after our investigation. The Texas Medical Board just revised its guidance for practitioners in facilities offering services like Botox injections. The revised rules clarify such procedures are considered medical and must be administered by a Texas licensed physician or others qualified to inject under a doctor's supervision. Facilities where injections happen must now post the name and the board license number of the delegating physician in all public areas and treatment rooms. All advertising must also feature that physician's name, and all staff must wear ID showing their name and credentials. This comes as a state lawmaker pushes for more oversight surrounding Botox, following medical emergencies, possible lack of supervision, and our team's reporting. We uncovered how anyone in Texas can become certified to do the injections, happening sometimes out of the back room of salons and boutiques. Now, investigator Arzo Dost explains health advocates worry about severe outcomes if lawmakers don't address these concerns this session.
It was filed back in November.
Dr. Kelly Green is an ophthalmologist in Marble Falls.
It got referred to Business and Commerce.
And in the last few weeks, she's had her eye on Senate Bill 378, which would prevent barbers, cosmetologists, and estheticians from administering Botox and other injectables unless they're licensed or authorized to give the shots.
I have had patients who've had their eyelid come down from Botox done elsewhere.
Patient safety is why Dr. Green says she co-founded Texas 400. The grassroots group of doctors advocate for patient protection legislation.
It's considered, medical. It's not considered cosmetology. So it's not appropriate for someone with no medical training at all to be doing.
Anyone can get trained to administer Botox in the state as long as it's under the supervision of a medical professional, like a physician assistant, an advanced practice registered nurse, or a doctor serving as a medical director in case there are complications. We previously shared the story of a woman who had a medical emergency in Dublin, north of Austin.
Everyone was just kind of panicking and was like, oh my gosh, what's going on? And then the EMS and police arrived.
The woman wanted her privacy protected, but told us she fainted after getting a Botox treatment at a shop in town. An EMS report says she had a seizure and was vomiting. The police department launched an investigation into whether or not the injector was practicing medicine without a license. That investigation is ongoing. A spokesperson with the department says it's now working closely with the FDA. Why does Texas need this legislation?
We need to make sure that injury and harm does not occur.
Senator Charles Schwager, who is also a doctor, refiled the bill this session to give the Texas Department of Licensing and Regulation authority to discipline those professionals if something goes wrong.
Whenever you're injecting something, speaking as a surgeon, it's important that the person doing that injecting or doing that cutting knows what they're doing.
Cosmetologists wouldn't be able to do something more invasive than a facial or other, waxing.
Dr. Green says it's time for more oversight.
Some of this is being done in hair salons, boutiques. We'll have like a little closet set up in the back where people are getting Botox. I mean, it's completely bonkers.
Earlier this month, Senator Schwartner's bill was referred to the Senate Business and Commerce Committee. A hearing hasn't been scheduled yet. The Dublin Police Department hopes to be at that hearing to share more about its investigation with lawmakers. And we'll, of course, keep you posted. At the Capitol, Arzo Dos for State of Texas.
Thanks, Arzo. Beyond the revised guidance we told you about earlier, the Texas Medical Board can take action against doctors and other individuals for either improper supervision or the unauthorized practice of medicine. Since our reporting in May, TMB disciplinary records show more than 20 new actions taken against individuals specifically related to med spas or non-surgical cosmetic procedures. Our investigators have not found any action related to the Dublin case. A TMB spokesperson says the agency cannot confirm or deny any complaints or investigations until action has been taken. Check out our complete coverage right now on our website. Just look for the links in this week's State of Texas story. Thank you again for joining us for State of Texas. I'm Dylan McKim. We'll be right back here next week to bring you an in-depth look at Texas politics.